Hi, hope you're all well. I'm Viv, I'm the face behind Skinpharma Aesthetics in Stockton-on-Tees, and this is, I think, the 8th in a weekly series of lives I'm doing with Dr. Sunny Dhesi, who's hopefully going to join me shortly. We've been talking about our ultrasound journey and the use in aesthetics. Hiya, Sunny. I'll just add him on. Let's just accept it. There we go. Tonight, we thought we'd continue with our series looking at use of ultrasound in non-surgical rhinoplasty. Hi, Sunny.
Hello, Viv. How are you?
Fine. I can't believe it's been 3 odd weeks since we last did a live together.
It has been. It has been. Well, you've been very busy. So I'm very interested to ask you. Well, obviously I know where you've been, but I think for everyone watching, it'd be quite interesting. So, yeah. I'm definitely interested to hear about Amsterdam with Tom van Eyck. So how did that go?
That was great. I was over in Amsterdam about 3 weeks back, training with Tom van Eyck. He's a Dutch specialist, world specialist in dermal filler injectable treatments, and he has his own academy in the centre of Amsterdam. So I flew over about 3 weeks back and carried out training with him, with a group of practitioners from all around the world. There was about 8 of us all together, and we trained in a number of injection techniques to work on different facial problems that can be used in different aesthetic issues, the patients might have. Great time I had. We went out for a meal afterwards. It was really nice speaking to him. We've got on well for the last few years, and I think we're about the same age. We have the same interests, and we've got the same sense of humour. So we tend to laugh at the same things. So we enjoyed working in the training, and we enjoyed having a meal afterwards.
So about the training, what was it? Why did you what was the training that you'd obviously signed up to? What was it exactly that you were covering with him?
It was covering dermal filler treatments and using safe techniques to inject dermal filler to create certain effects around the face, doing it safely and as effectively as possible. He's got a number of techniques that he's created over a number of years. Fern pattern technique, working on skin strengthening, reducing the bending of skin. So superficial lines around the face can be strengthened using that particular technique. Lip tenting technique, a lot of people don't realise, but it was Tom who actually invented the technique to lift the lip borders to produce a natural shape around the lips.
I didn't know that.
Yeah,
that was Tom.
Tom, over 15 years back, I think he invented that technique, and he's still providing training to help practitioners use that tenting technique properly. Julie Horn uses that. She calls it in her own words, she calls it fencing. She uses it slightly differently. But there's another technique, Palmer technique, which involves using a form of strengthening, but also filling under the skin to produce volumizing in a natural, effective way, but also doing it in a very safe manner as well. I don't think Tom uses ultrasound actually, but he knows that I do, and we both know Leonie, who's a world specialist in ultrasound. So for anyone considering masterclass training with dermal fillers, I'd recommend going to Amsterdam and training with Tom.
So there's a couple of questions that come to mind that I'm sure people watching would be interested in. Is one, and this is for both practitioners who are watching and also clients and patients as well, because it gives you an idea for patients and clients. What it gives you an idea is how much money it costs to actually go and train with someone. And obviously Viv's gone to a very advanced class. It's not just for beginners. And so how much was it?
For training with Tom over in Amsterdam, that included the actual full day's training, included the models, included all the products, etc. I didn't need to do anything. That was around about 15 to 1600 for that day's training. You could spend more, you could spend less. But he did it in a really friendly, effective manner. It was nice talking to him. He wasn't talking to us as children. He was talking to us as one of himself, you know, as a practitioner. And it was friendly, it was effective. We spoke to each other in the group together. We learned from each other's practical work, and it's a thoroughly enjoyable time. You can talk about.
Was it just one day you did then?
It was one day. I was there for a couple of days, but I was spending one day at the training with Tom at his academy. But you can do a lot of different types of training. You can spend days training, doing different techniques. It really depends what you want to do.
And so for those, because practitioners will be interested, we might as well go through the logistics of it. So about £1,600 for a day's training. I'm guessing you could have done the whole weekend as well. Would that have been double?
Could have. Tom tends to spend a day at a time doing the training.
Did you fly from Manchester or did you fly from Bradford?
I flew from Teesside, direct from Teesside over to Schiphol, direct flight, and straight in.
How much was the flight from Teesside?
The flight was, it's probably, I'm trying to think how much it was. It's probably about it's about 200 and something pounds return. There was a hotel to stay at for a day or two
is that
as well.
Recommended?
Hotel was nearby. I just found it myself, to be honest. I just found that small hotel. Easy 5-minute walk from the training academy. Quick, easy transport using train from Schiphol directly to the centre of Amsterdam. And then a tram, 10-15-minute tram journey straight to the hotel from the centre of Amsterdam. Easy for me. It was actually easy for me to go and train with Tom in Amsterdam than it would be for me to train in London or another part of the UK, to be honest.
Really?
Yeah.
Is that what you told your missus, that it's easy for me to fly to Amsterdam?
She knows I love travelling anyway, but it really is. It's actually easier.
I'll have to try that one. So, yeah,
I'm being honest with you there. It is actually easier for me to fly there than to go to London.
If it works for you, Viv, I'll try it myself. I'll let everyone know how that works out. That's really exciting. Because obviously Tom Van Eyck is a master injector and obviously a master teacher as well. So that's really interesting. So Viv, our subject today, just so for anyone that's just joining us now, we are. Well, Viv's just explained where he's been on holiday, and obviously he was training with Tom Van Eyck in Amsterdam. And now, if you want to introduce the topic for today, Viv.
Yeah, so we've been going each week through our story. There's Lynette, Kalo Aesthetics, Northern Ireland. I think I've been speaking to her quite a bit since she's been watching us. So tonight, it's continuation of our ultrasound journey in our aesthetics work. And I thought it'd be interesting to look at one particular area of the face, the nose. So non-surgical rhinoplasty, as it's called, involves the use of dermal filler injections injected in various parts of the nose to reshape it, to straighten it, to lift the tip, to do various different things. Practitioners need to be trained properly to carry out the work. It's not a simple, easy treatment to carry out. It also is highly risky. And there is also, as I say, Kalo Aesthetics, Lynette, she mentioned today that she is trained to do it, but she chooses not to actually do it because of the risks. And I think that's probably the same with a lot of practitioners. They're quite worried because of the problems related to complications with non-surgical rhinoplasty. So what I'll do, I've got a few shots of areas involving non-surgical rhinoplasty. So this is a patient of mine who I treated some time back, and the shot at the top is the before shot, which you can see here. This is the after shot following dermal filler treatment to straighten the nose. She'd actually had surgical rhinoplasty carried out. She didn't like the shape of the nose following the surgical work, so she asked if I could help reshape the tip of the nose slightly to just give her a slightly softer end of the nose, which I managed to do.
Viv, I'll pause you there because that's a really good point. Yeah. There's a little flag that's gone up there for me, and for anyone else, any practitioner wise, and actually interesting if you're a client or patient watching. So Viv's just described. So Viv, let me give you a little bit of background on Viv. So Viv, yeah, I completely agree, Lynette, that is a very good result. So Viv, you have quite a lot of experience of dealing with clients, patients who have had scar or malformations or deformities. So
Yeah.
when Viv sort of just shows you, this amazing picture, which is, really, really good result, you're looking at someone who has consulted, I'm guessing, hundreds of patients who have an existing deformity or scar,
Yeah.
for example, cleft lips. So
Yeah.
it's just a good flag there for everyone that's watching to say, listen, great result, but Viv is displaying a result that has come from hours of patient selection. So
Yeah. It takes time and it takes skill and knowledge to build up your ability to carry out treatments. And when you see a shot of a before and after, it might look like it's a simple thing to do, but you don't really realize the amount of work that's gone into doing something like that. It looks simple. You see adverts on Instagram and Facebook, 15-minute nose job. Now, that to me is a little bit silly. I don't think that's a great way of describing the process, because it's not just 15 minutes. It takes years of skill, practice and experience to be able to do a treatment in 15 minutes. And I think sometimes patients don't realize that. They only see what's advertised to them. But if you do have the knowledge, skill and ability, you still can't guarantee safety. Like, despite me having knowledge, training, experience, I still feel occasionally a little worried about doing certain treatments. It's not like every treatment is an easy treatment to do. You still need to spend time with a patient, find out what the problem is and go through it properly. And this is where the ultrasound comes in, as we've been talking for the last 7-8 weeks.
So what, for everyone watching, listening, is that so Viv's got years of experience, we both have. Patient selection is really important. So 15 minutes that, classically cliched advertised, yes, it might actually only take 15 or 20 minutes, but you've got years of experience of making sure when the patient comes in that is the right treatment for them. So, and again, another point, Viv, that you it's almost secondhand to you because you are experienced, but this is a patient who had a surgical rhinoplasty, who'd had surgery to the nose, but wasn't happy with the shape of it. And then, there's confidence there to say from you that actually, I recognize that you're unhappy after surgery, so I'm going to treat you very carefully, invest my time. Just out of interest for that patient, when she said that she'd had a surgical rhinoplasty and she wasn't happy, how did you approach that from a kind of...
Well, it was difficult because, as I say, the upper shot is following surgical rhinoplasty, and the lower shot is following dermal filler treatment after the work that I did. That's the outcome following dermal filler treatment. Now, it's difficult because surgical treatment, you think, is the end all of any aesthetic treatment. You think that's it, you don't need any further treatment. But surgical treatment doesn't always give you the outcome that you want. And with reshaping of the nose, it doesn't always produce the perfect shape for an individual. And when that happens, going through further surgery is just going to cause more trauma and more risk. So it is possible to use dermal filler treatments, but you've got to do it very, very carefully because the anatomy has been changed as a result of the surgery. So I went through a consultation with the patient. She was just wanting an improvement. She knew there was risks involved in further treatment, but she was willing to take the risk, knowing the ability that I had to help her. I went through the pros and cons of treatment, looked at what the outcome could be. I looked at what the downfalls might be. If something were to go wrong, how would it affect her? So as long as you go through that process with every patient and they're aware of the risks, they're aware of the pitfalls, and you have standards in place to deal with problems, then that, to me, is a suitable position to be in. You need to be careful when you do anything.
Perfect. That's perfect. I just say a quick hi to Dr. Jigna Patel, who's joined us as well. Actually, Tarina from Vivesi So I'm not sure if Tarina was there. So I was at Face Conference at the weekend. So the Vivacity had a really good fillers workshop. And we've got Lashes of Huddersfield and Joanna. So that's brilliant. So really good. Yeah. And the very fact that you went through all of that with the patient, it also, and now we're just joined by Angelica from Get Harley as well. So brilliant, everyone's joining us now. So it's really good that you spent the time with her, because it allows you to identify whether this patient's suitable for the treatment. Yeah. So that leads us neatly on, because from a practitioner who, I'm not trained in non-surgical rhinoplasties, and if I was going to do it just like with Lynette from Kalo, I would probably do a year's worth of training before I felt even comfortable, because at Face Conference, there was a really good talk from an ENT surgeon, and just the scope of patient selection, you need to have confidence and skill before you do it. So that leads us neatly on to, how can we implement ultrasound into our practice if we're doing surgical?
So ultrasound, we've been talking about how we use ultrasound. Now, for practitioners, a lot of practitioners get this magazine, Aesthetics Journal, and this current month's edition, the June edition, looks at complications. And in there is an article by Dr. Zainab, I'm just trying to find it actually, Sunny, I'll be 1 second. Zainab Al-Mukhtar, who's a dentist, and she's also a trainer. And she was involved in training when I went down to London in March.
It's this one's a bit difficult because it's back to front. So anyone reading that now?
Oh yes, sorry.
So just talk us through it.
Yeah. So basically, in the article, it looks at how complications involving non-surgical rhinoplasty can be minimised and reduced and avoided by using ultrasound. So Zainab talks about how she carries out treatments using ultrasound. And what I've got here is a few shots. So I actually helped her produce images for the article in the magazine. And this is one of them. So this shows a nose. So you can see the shape of the nose there. And you can see an augmented ultrasound scan. It's vertical, it's not horizontal, but it shows where the tissue is relative to the nose shape. You've got the skin on the far side here. So this is the top of the scan. As you go further down, you get towards the bone and the cartilage. So the cartilage is here. And this is this part of the nose. There's skin, there's fatty tissue, there is muscle. All of these things are visible within an ultrasound scan. I used computer graphic augmentation to layer colour over the scan so you can see it more easily. But that's what the benefit of using ultrasound is. So with ultrasound, we can scan the nose, we can see what is under the skin, and it gives us a pair of eyes that we didn't previously have. Now, the problem with non-surgical rhinoplasty is the biggest complication of non-surgical rhinoplasty is, unfortunately, permanent blindness. Doesn't happen very often, but it can happen.
Let's just, because that's a bit of a shocker, isn't it? You just dropped a bomb.
Yeah.
So anyone listening now, definitely non-surgical rhinoplasty. So a nose job using fillers can result in blindness. And Viv, do you want to take us through it? It's to do with your blood vessels, obviously. Blood vessels run deep into here. So just in layman's terms, just explain why it would lead to blindness.
With the nose has got blood vessels that run along the length of it. These blood vessels provide oxygen and nutrients to the nose to help the tissue grow as normal. Now, when you carry out a non-surgical rhinoplasty treatment, you use dermal filler, which is a type of gel. It's firm and it takes up volume, it takes up space. Now, if you were to inject in the nose, generally you work along the middle of the nose, that's where we're trained to inject. If you, for some reason, injected into one of these blood vessels that run along the nose, hopefully not in the centre, hopefully either side of the centre line, but if you were to inject filler into a blood vessel, you could block it, you could cause movement of the filler away from the nose, and you could stop blood flowing from the nose to other areas of the face. Now, some of the blood vessels that run along the nose are connected directly and indirectly to the blood vessels supplying the back of the eye. And if a vessel were to be blocked in the nose, there's a risk you will also block blood supply to the back of the eye as well.
Yeah.
If it isn't detected, if it isn't treated properly, the risk is that blockage will cause a lack of oxygen to reach the back of the eye. The retina can end up dying, the tissue can die, and you can end up blind, which is the biggest problem of doing these treatments.
So just for any clients, patients watching there, it's, just that brief description is when someone's injecting, who's a healthcare professional like Viv and I, that thought process is going through our minds constantly. So from needle, hand to needle to injection, as that thumb is pushing down that plunger, pushing that gel-like substance into your nose,
yeah,
we are recognizing that anatomy, and we're making sure that we're reassessing every time. And that's come through years of experience. Now, Viv, just to help us along with this process, so obviously that's the risk, worst case scenario, blindness, which is a higher risk. So how did Dr. Al-Mukhtar, how did she suggest that using ultrasound?
So she carried out some scans of her own, and she used images in the magazine article looking at how complications could be avoided using ultrasound. So I actually augmented one of the scans that she did. So I'll show you what this scan looks like. Just get it up now if I can find it. There we go. Right, this is a scan, and the upper part of the image is skin, lower part is bone, and in between is the various tissue between the skin of the nose and the bone the bone of the nose lower down. Now the distance between the skin and the bone is less than 0.8 centimeters. It's not a big distance. And if you imagine you're moving a needle around,
there we go. Yeah.
That's the augmented image. So this shows you the tissue. If you're moving a needle into various layers and there's a vessel in one of these layers and you hit it, you can end up blocking it, and you can cause a problem with reducing blood supply. Now, with the blood vessels, they can be in different layers. You're hoping they're not in the very bottom layer where the bone is, because that's where the needle needs to be to lay the filler in the right position. So what the ultrasound shows is where the blood vessels are. It shows us where blood supply is flowing in the nose at various layers. It can be in various layers depending on the position that you're injecting at. If it's dependent on what you're doing with the filler. If you're raising the tip of the nose, you would need to inject further down. If you're trying to straighten the bridge of the nose, you'd work higher up. But using an ultrasound scanner, like, as I say, like the Claris that we use, you can scan vertically downwards and you can see what is under the skin. So it gives us an idea of where we need to be careful when we're injecting. Zainab, when she wrote the article, she mentioned a couple of cases that she was involved with, and she did some scanning, and she found that the blood supply was very close to the bone where she wanted to place filler in the tip of the nose. So with the cartilage in the tip of the nose. So she avoided injecting there. She basically didn't inject where she would have normally had she not have the ultrasound scanner. So the scanner helped her to basically avoid a problem from occurring. You can use the scanner to give you vision that you wouldn't have. Now, I just find it odd that the practitioners are quite happy to do a 15-minute nose job and not worry about the outcome of having that needle.
Okay. Yeah, no, that's fine. That's for another day. So, Viv, you had one last. I mean, time's getting on for us, and we want to keep everyone's attention on it. You had a little story for us.
Yeah. Well, what about you? You mentioned a story to me as well, didn't you?
Mine doesn't sound exciting. No, it's really interesting. It was a case today. So I had a phone. I'd done some what I call global fillers on someone. So is a lady in her late 60s, 2-stage fillers, and she'd ended up after the first stage. Well, not ended up. It's just a hollow, just underneath the arch of the cheek here, was just,
Yeah.
you know, it was, everywhere else had been rejuvenated, but this was still evident on both sides, one more than the other. So
Yeah.
I'd used Teoxane, I think it might be RHA3, so a very soft filler. And
Yeah.
because there's nothing behind here, it's not like
Yeah.
you can, as you know, you can't just place filler on and expect it to just pop out. You
Yeah.
have to layer the filler in almost a lattice structure. So she's very happy with the results, and she went away, and then about I think it was this week, in fact, she just messaged and said, you know, Dr. Sunny, I've come back from holiday, and only one person had pointed it out. I think it was a husband, in fact. He just said, oh, have you got a bruise on your cheek where we'd injected? And she said, no, it's been 5 weeks. So I just said, look, come in and we'll check it out, see what it is. It's unlikely to be a bruise. And interestingly, in certain aspects of light, you couldn't see it. Direct light, you couldn't see it. It was only at an angle that you would notice a 5p piece size, not even that very defined, blue discoloration. So, I mean, that, anyway, any practitioners watching, well, that's not particularly exciting, that's just Tyndall effect. So where, you know, it's why the sky is blue. Basically, the filler is a bit more superficial than it should be, or it's achieved the aesthetic result, but it's just a bit superficial. So the filler substance absorbs red light and reflects blue light. Hence, at certain angles, you get this blue discoloration. So, you know what, normally you would just be able to explain that to a patient. And I guess they just have to take your word for it. But the beauty of ultrasound today was that I said, that's no problem at all. This is what it is. She understood, said, jump on the couch, put some ultrasound gel on. And we were able to visualize filler where it was, you know, nice honeycomb texture to where we put filler before, very nice and tensile in places, especially the cheeks, the anterior aspect here for where we'd injected. But just here, just above the muscle, you could just see more of a bolus of filler. Not you couldn't feel it, but you could see it on the ultrasound. I can share those slides with you another time. But basically, the ultrasound allowed myself and the client, the patient, to physically see that we've achieved a really good aesthetic result. The hollow's no longer there. And I said, well, look, there's two options. We can either dissolve it or we can just leave it. It will probably get better with time. And if not, we can look at it later. And, you know, she said, I'm very happy with the result. I can see what it is. I can see what it's doing. And that's a diagnosis that's, you know, that the patient's happy with. So that was my Tyndall story for today with ultrasound. So how about you there? Yours is a bit more interesting.
It was just a story of a new patient who was in touch earlier this week, and I haven't yet gone through consultation with her. I will be doing that next week. But we spoke on the phone, and she mentioned that she's had filler treatments around the face previously for a number of years. But unfortunately, about 2 years ago, she had an accident. She fell down the stairs and she fractured her cheekbone and her jaw, which unfortunately meant she needed surgery. So she has metal plates in her face to hold the bones in position. She's had that for some time, and she's wanting treatment now again following the accident and the surgery. But the problem is she doesn't trust most practitioners. She was happy with the treatment she's had already prior to the accident, but because of the lack of knowledge of most practitioners dealing with problems involving things like metal plates, she wants to see someone who's got the ability to look under her skin and treat the problem properly and safely and effectively. So she was in touch after seeing some of the work we've been doing and looking at some of the work I've done involving fillers and ultrasound, and she's coming to see what I can do to help her. So I'll hopefully see her next week. I was in touch with Leonie Schelker about this patient as well, and she's interested to see how the plates show up on a scan and to see how treatment could be provided as safely as possible, you know, without affecting the current state of her anatomy, without affecting the fact that the plates are in a certain position in her face. If we were to do a standard cheek lift treatment for a normal patient, we wouldn't be worried about the needle touching the bone in a certain position. But with a patient who's had surgery, you don't really know exactly what you're going to hit when you touch that needle against the bone. Are you going to be touching a plate? Are you going to be touching bone? Or are you going to be going through a vessel because of the surgery's moved an artery out of position? So that's where the ultrasound comes in. Should help me do it properly.
So I think, and anyone that's wondering why does it matter? Why can't you just inject onto a metal plate? Well, obviously metal doesn't have the same resilience. The HA gel is not designed to go onto a metal plate. And also, there's a risk of infection. You'd have to once an infection is introduced onto metal, you actually normally have to remove that metal or treat with antibiotics. But Viv, that would be really interesting to follow up once you'd seen her. I mean, I've got actually, now that you reminded me, I've got a patient with metal plates, and we actually ultrasounded her prior to doing IPL, in fact.
Oh, right. Okay.
That's for another time. So when you next share that story with me, I'll share the IPL laser plate. IPL laser plate. That's a new one.
Yeah. It'd be interesting to see.
It's 9 o'clock. So do you want to just give everyone a little brief of what we're planning for the next few weeks?
We'll carry on with the ultrasound series. We'll look at another topic next week, but I was speaking with, as I say, Leonie Schelke, who's probably the world ultrasound specialist in aesthetics and complications. She's been watching our lives and she loves them, and she's happy for us to speak to her in a live to talk about ultrasound as well. So we can do that in the next few weeks, but we could potentially, perhaps next week, go through some of the work that she does. We can put together some bits and pieces, and we can talk about some of the things she's involved with in the ultrasound field, helping practitioners with certain issues, and how she uses ultrasound to make aesthetic work and complications easier to deal with. So we can look at that next week if you fancy.
That'll be brilliant. I look forward to it. So thanks everyone for watching. That's Viv and I signing off on another Thursday. It's glad to be back, Viv. I've enjoyed it as always.
Yeah.
So yeah, thanks very much for having me.
Great. No, thanks a lot, and we'll catch up again next Thursday at 8:30 then, Sunny.
Brilliant. Have a good one, Viv, and thanks everyone for watching. Cheers.
Okay.
Bye-bye.
Thanks a lot.
Bye-bye.
See ya.